This morning on BRN, how a diet high in fruits and vegetables may help reduce heart and kidney disease. And joining me now to discuss this and a lot more, Dr. David Wesson is from the Dell Medical School at the University of Texas at Austin. Dr. Wesson, so great to see you. Thanks so much for joining us on the program this morning.
Jeff, I'm delighted that you've invited me to join you, so thank you.
Well, Doctor, obviously there's a lot of new studies out, a lot of information. How important is a diet of fruits and vegetables to mitigating or minimizing some of these chronic diseases like heart disease, cancer, et cetera?
Well, our study, Jeff, is the latest to show that it is very important. In our study, this addition of extra fruits and vegetables on top of the typical way by which we treat individuals with hypertension or high blood pressure gave better kidney health and better heart health, and did so at lower doses of the traditional medicines that we use to treat folks who have hypertension.
And the old rule of thumb, at least my doctor, was strive for 5, I think was the rule of thumb that he recommended to me. How do we incorporate, oftentimes, you know the American diet, how do we incorporate more fruits and vegetables? Is there a rule of thumb that you can recommend, sir?
Well, the American Dietetic Association recommends 4 to 5 cups of fruits and vegetables per day. That's just for all of us, not just for people that have high blood pressure, but we recognize that extra fruit and vegetables, not only in our study, but other studies, shows benefits folks who have high blood pressure. Unfortunately, our standard diet is very low in fruits and vegetables and very high in animal products. So I think the more we look at making fruit and vegetable, particularly vegetable intake, more tasty salads, more attractive presentations of vegetables. Unfortunately, in most Western societies, we spend the time focusing on making attractive presentations, eating-wise, of animal products like meats and cheeses, but we are less focused on making attractive fruits and vegetables. So vegetables for our meals, and fruits in particular for snacks.
Yeah, and I mean, anecdotally, I completely agree. I've said I don't have your expertise. Can you, if you follow this prescription, this diet, can you actually reverse some of the chronic diseases that we're talking about this morning that you mentioned, the hypertension, the heart disease? So if you are inflicted with these, maybe it's genetic, maybe you have a predisposition, can you actually help yourself and go backwards and reverse some of these diseases?
Well, reverse is a strong word, but let me say this. Adding fruits and vegetables to your diet can lower your blood pressure. We've known that for 40 years. What our study shows is that in addition to lowering one's blood pressure, you get better kidney health and you get better heart health. Now, it doesn't reverse any kidney damage, but the addition of the fruits and vegetables appears to mitigate, that is, keep it from getting worse. For individuals who don't already have heart disease, adding fruits and vegetables to your diet reduces the risk that you will subsequently get heart disease. So this is more of a prevention intervention and less so of one that reverses existing disease.
And doctor, does this inform your colleagues that are internists or working with the day-to-day patient? They're going to see their doctor on an annual basis. I mean, I would imagine that this further informs these professionals to help guide their patients and their clients and say, hey, you need to really think about this. You need to really think about, even if you're 20 or if you're 50 or if you're 80, you really want to follow this because this is the right rule of thumb.
Absolutely, Jeff, you make a very good point. As I said, we've known for a long time, data has shown us for a long time that adding fruits and vegetables to your diet helps to get your blood pressure down. But we physicians have been a bit lax in emphasizing that because we recognize how very hard it is for us to change our diets. And so we've become less excited about it because how difficult it is. And so one of the things that my research group has emphasized, in addition to emphasizing the patient and physician interaction around this issue, we think about it now in terms of society. So right now, certainly in the United States, uh, most of us already eat relatively low amounts of fruits and vegetables, and that is particularly true in under-resourced communities. And so our effort now is to push from a societal level to make fresh fruits and vegetables more accessible, particularly to under-resourced communities. For instance, the study that we're talking about now was done in an under-resourced community, and the average fruit and vegetable intake in this community was 1 cup of fruits and vegetables per day, whereas the American Dietetic Association recommends 4 to 5. Most surveys show that Americans on average eat 2 to 3, but in this community, it was 1 cup per day. So that lets you know just how difficult access individuals, particularly under-resourced communities, have to fresh fruits and vegetables.
Yeah, I mean, the 20% is not going to get you. 20% of what the prescription is not going to get you there. Last question, doctor. In terms of educating these groups and reaching these individuals in particular, but broadly speaking, the American society, what do we need to do better? Does it need to be a national campaign similar to what the PSAs that we see for other stop smoking or get exercising? What do we need to do to reach communities that are not being reached today?
Very good question, Jeff. We need to educate our communities overall about what a healthy diet looks like. It's interesting, when we talk to individuals in this community in which we did this work, for a breakfast, they would say, well, a healthy breakfast is bacon, sausage, eggs, and cheesy grits.
Mm.
That's a general view of what a healthy diet is. And most physicians, and certainly most dietitians, would have a seizure if they would have heard that. A healthy diet and a healthy breakfast in particular is one that has whole grains like oatmeal, and very importantly, has a lot of fruit, cantaloupe, watermelon, apples, oranges, things like that. So part of what you are suggesting is that we educate the public overall as to what a healthy diet looks like. And that's one that includes a lot of plants, particularly fruits and vegetables. Now, before I end, and I'm in Texas, where cattle is king and meat is king, let me hasten to say, we are not saying that one needs to stop eating meat. We're not saying that one has to become a vegan or a vegetarian. What we are saying is one has to eat more fruits and vegetables than meat. That makes for a good heart healthy and a kidney healthy diet.
Yeah, well said, doctor. We're going to have to leave it there. Dr. Wesson, thanks so much for joining us, for sharing the information, and we look forward to having you back on the program again very soon.
Thank you again, and I welcome another opportunity.
And don't forget to sign up for our daily newsletter, The Morning Pulse, to get all the news in one place. Details at our website. Till tomorrow, I'm Jeffrey Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.